My name is Dr. Mitchell Schuster. I'm a family physician from Boca Raton, Florida. I've done a lot of work over the last 25 years in international efforts. The situation here is rather grim and desperate. We're working under conditions where we have very little supplies. The risk of infection is horrific, and I'm afraid that a lot of the people we're initially saving may succumb to infection over the next few days. Just ask her if she's having any pain, please. Basically, we've been trying to set up a system which works, but every day we're reinventing the wheel. We seem to come in some days when all the patients are in the buildings, and some days the patients are out of the buildings. Every time there's a tremor, there's panic. I went to Sri Lanka for the tsunami, for instance. It was a very well-defined swath of destruction. The wave went in 1 or 2 miles, and beyond that, the infrastructure was intact. Here, there has been an underlying sense of unease because there is no sense of safety for the workers or the patients, and that has created some difficulties. There is no infrastructure, there's no electricity. Most of the injuries that have been coming in since we arrived Sunday morning have been extremity injuries, very graphic wounds with a lot of problems with infection. There is basically no choice that we have right now. It's either limb or life. Maybe a few days down the road when we're able to salvage both, we can do so. It says Miami Hospital.
Okay.
She went already or not yet?
No problem.
No. We're having translation problems. One of the central ethical problems I've had personally as a physician is the question of the few versus the many. I think initially there was concern about rescuing people in rubble, and that seemed to draw the interest of the media and the world's attention in terms of pulling bodies alive out of the rubble. I'm beginning to think perhaps what should be done is thinking about the millions of people who are not under the rubble on the first day of a disaster. Because what happens is we end up chasing our tail, we end up trying to catch up. By the time we have the supplies in here for the masses, it's almost too late for many of them.